Mental health of the country. The country's mental illness burden has grown to such proportions that the government has decided to frame the first ever official national policy on mental health. If one looks at mental cases, the tragedy that fills the lives of mental patients, the World Health Organization estimates that 76 to 85% of people with severe mental illnesses do not receive treatment in the low and middle income countries group, which includes India as well. This is hardly surprising, as there are only 40 to 50 mental health hospitals all across India. There are only 0.3 to 0.4 per 1 lakh population of doctors trained in psychiatry, 0.16 to 0.2 nurses trained in mental health, 0.05 psychologists, and 0.03 mental health social workers. Besides this, the medical professionals encounter during their academic and professional pursuits. Stigma is a pricky problem which is very resistant to correction. It prevents individuals from seeking timely help due to the fear of being labeled as a mental patient, which has social and occupational ramifications. Unfortunately, the condescending attitude towards mental health is pervasive, and even medical professionals look down upon mental health services. Popular perception is often shaped by the media, and the situation is equally grim in this domain too. The World Health Organization has predicted that about 20% of India's population would suffer from some form of mental illness by 2020. The country has only about 3,500 psychiatrists. Therefore, the government is confronted with the problem of lowering this gap significantly over the next decade. In this context, the National Mental Health Policy is being developed. The Universal Health Insurance, which will be a component of Universal Health Assurance Mission, that is UHAM, will also cover those who need treatment for common problems. Suicides and the state of mental health care in India. Suicides in India, according to a World Health Organization report, India belongs to the category of nations in which suicide rates are more than 21.1% of 1 lakh of population, which is a definite red zone as far as the global statistics are concerned. This means that 1.4 lakh people have already taken the extreme step in the country in 2013, according to the National Crime Records Bureau. That's 15 suicides per hour. Recently, Bangalore, which is the IT capital of India, gained the dubious distinction of becoming the unofficial suicide capital. Even though it was second behind Chennai in 2013, it would not be too long before it overtook Chennai in the suicide statistics table. The suicide rate shoots up to 35.5 when the age group of 15 to 29 years is considered. In this, women overtake the men. This could perhaps be due to the pressures and demands of a married life and a new family environment that they have to get adjusted to. In the next age decade, 30 to 49 years, the men outnumber the women considerably. This could be due to the fact that they have to struggle to acclimatize to the pressures of worryingly, the rate of suicide is as high as 20.9 in the above 70-year-old category, which is the result of broken families, with children abandoning their elderly parents to competitive life, difficult interpersonal relationships, and substance abuse or drugs. A life of solitude and neglect. These are two niche groups that are historically associated with a high suicide risk. They are recently married housewives and farmers. In the case of housewives, the pressure of adjusting to an alien and potentially hostile family environment as the newlywed woman moves to her husband's house, dowry-related harassment, and an overall loss of a sense of identity may be the possible factors at play. Whereas in the case of farmers, socio-economic issues predominate as debt-ridden farmers, abandoned by society and the state, take the extreme step. Presence of mental illnesses. Factors and situation. It is clear that mental illness significantly increases the suicide risk. In particular, depression and schizophrenia are associated with a high suicide risk. Some of the associated factors are drug and alcohol. Drinking and taking drugs are definite risk factors for suicide, as they cause a sense of disinhibition and loss of self-control, which in turn increases impulsivity and irresponsible actions, be it drunk driving, homicide, sexual assaults, or suicide. Presence of medical illnesses. especially those that are chronic, painful, or end-stage conditions such as AIDS or cancer. A family history of suicide. Studies have shown that having a first-degree relative who has committed suicide increases the risk of suicide in the individual. There has been considerable progress over a period of time in treatment methods for mental patients, and the recovery rates have improved. Unfortunately, society still stigmatizes those who suffer from routine psychiatric problems, and so their treatment is either delayed or denied. This has warranted a need to build up a social movement to change mindsets and focus on the human dimension of mental illnesses. Realizing the significance of the disease, the government has decided to observe October 10th throughout the country as National Mental Health Day. This will be an occasion to generate awareness against stigmatization of people with mental illnesses and highlight the symptoms and remedial opportunities for those with depression, schizophrenia, bipolar syndrome, etc. So what can be done? The state policies and implementation of national strategies at the grassroots level should be taken up all across the country. One hopes that the recent launch of the National Mental Health Policy by the Ministry of Health would be a new beginning in achieving this. Quite apart from all this, at the individual level, there are several things that one can do or watch out for to help those with suicidal ideas. Watch out for the warning signs: withdrawal, isolation, communicating less, not eating, being evasive in replies, losing interest in hobbies, making last-minute preparations such as settling finances, distributing wealth or personal possessions, and finalizing wills are some of the things that a person contemplating suicide might do. Communicate. It is always better to open up channels of communication with a person who has expressed a suicidal wish. Face-to-face talk is even better, but electronic media can also be made use of to help the person from committing deliberate self-harm. Also to be remembered is that repeated deliberate self-harm is a risk factor for suicide. Encouraging the person to seek professional help will also help. Treating other conditions. It is a well-recognized medical truism that in any complex condition, one should treat the underlying cause. So it is with suicide. The underlying mental and medical conditions should be adequately treated and the person regularly followed up. Reducing access. Keep medication, drugs, pesticides, inflammable liquids locked, build barriers in high-rise buildings, erect fences near railway platforms, restrict access to water bodies, etc. Encourage the person to keep away from drugs and alcohol. If necessary, seek professional help to stop drug dependence. Picking up the cause. There are a number of voluntary and government organizations working to reduce suicide rates. NIMHANS, the premier mental health institute in the country, which is based in Bangalore and has launched a website for this purpose called gatekeepersindia.org. Encourage. Educate and motivate those around you to pick up the cause. Reducing stigma associated with mental disorders and suicide is very important in breaking barriers and for encouraging and improving access to services. Helplines. There are a number of suicide-specific helplines manned by trained professionals who could help the person who is on the verge of committing suicide.